Good morning. Good morning. I'm Johanna Derlega, publisher of The Hill. Welcome to this morning's briefing, Innovating to Improve Patient Health, a Solutions Conversation. I'd first like to start by thanking our sponsor, the Coalition for Affordable Prescription Drugs. Today's program is the last of a series of events sponsored by the Coalition to tackle some of the most pressing issues facing the U.S. healthcare industry. This morning, we are focused on strategies to improve patient outcomes. From tools to enhance medication access and adherence to strategies for preventing and managing chronic disease, patients have access to a host of new resources that offer them greater control of their health. But do enough patients know that these programs and resources exist? This morning we will hear from policymakers, health industry representatives, employers, and providers as they explore patient-centric solutions to improve the delivery of effective health care. Before we get started, just a few notes of housekeeping. In addition to those of you in the studio, we are live streaming on thehill.com. We ask that you keep your phones on silent, but we encourage you to join the conversation on social media. You can do that on Twitter @TheHillEvents, and you can comment using the hashtag #What'sNextHealth. We're going to be taking questions throughout the program, so keep an eye out for those on the team that have handheld mics. And finally, there is a short survey on your chairs. We would appreciate your feedback at the end of the program. So let's dive right in. We begin this morning with Congressman Bill Johnson. Congressman Johnson is a member of the House Committee on Energy and Commerce, and joining the congressman is my colleague, the Hill's editor-in-chief, Bob Cusack. Bob, over to you. Welcome.
Thanks, Johanna. Thanks, Congressman.
Good morning.
Healthcare is always a hot issue, and this time is no exception. It's kind of a general question. Just looking at the big, broad healthcare system, what is working and what needs major improvements?
Well, we're talking about innovation this morning. I think there's a lot of focus on innovation as it applies to policy. Because there's two different aspects of innovation. You've got policy innovation, and then you've got technological innovation. On the policy front, as you know, back in 2015, MACRA began to focus providers on quality-based outcomes rather than quantity-based outcomes. On the technological side, telehealth is emerging, especially in rural areas of the country, and offers so much promise. So you've got a lot of things, and I think largely it's taken us a while. You know, we didn't start doing major computing and communicating technologies until the 1940s and 50s, and so we're still really early, relatively speaking, to other great technological advances in human history. So we're still on the front end of that spectrum, and we're just now catching up to the impacts or the possible positive implications of information technology as it relates to healthcare.
You sit on the Energy and Commerce Committee, and that committee has battled over Obamacare, but also worked together on the 21st Century Cures Act. And what is the role for Congress to improve patient outcomes and health? And do you see what's on the Energy and Commerce Committee agenda, and do you see hope that, aside from Obamacare, that the parties can work together on at least some issues?
Well, we're certainly trying to get bipartisan support for efforts to improve the healthcare system, giving the American people the ability to expand the use of their health savings accounts so that they can pay for more of their routine health care out of their own pockets at a much cheaper cost, which also gives them some buy-in. See, one of the big issues that we have is that a lot of health care solutions up until the last 10 years or so didn't focus a lot on prevention and personal responsibility. But expanding health savings accounts where the American people see the money going out of their accounts, they know how much they're spending because they're the ones writing the checks. there's a degree of transparency that exists there that I believe will encourage Americans to develop a lot better health lifestyles, and we'll begin to see some of those costs drive down. The other thing I think you're going to see some focus on is public-private partnerships, like what we've seen with the FDA that recently announced the program with 7 private companies to streamline the process of approving their healthcare software, rather than having a company have to come back to the FDA each time they make an upgrade or a modification to that software, basically approving the approach of the company rather than individual software upgrades. So getting technology out so that it can be utilized is very important. And I think finally, something that we began to do in 21st Century Cures is shortening the time frame to bring new treatments and cures to the American people. Because prior to 21st Century Cures, and when I came into Congress in January of 2011, I was shocked to find out that on the average, it takes about 17 years in America to get new treatments and cures available for the general public. It's no wonder that many innovators are going to other countries to try to get permitting and the ability to provide those treatments and cures before they're available here in America. We've sort of thrown with an overzealous regulatory environment, we've sort of thrown a blanket over innovation in America, and we need to change that. We need to get those cures out there quicker, and that's one of the focuses of Energy and Commerce.
On healthcare quality, how big is the problem between getting care in a rural area compared to urban?
Well, it's a huge problem. Rural America has its challenges even without Obamacare. I mean, you have problems of keeping family practitioners, general practitioners, and specialty physicians in rural America in the first place. With the Affordable Care Act, or Obamacare, it became even worse. And this is not a political indictment on Obamacare this morning. Of course, we could have that discussion. But the truth of the matter is that many providers, especially in rural areas where a lot of the patients are Medicare patients, taking $750 billion out of Medicare, over $200 billion of that coming out of Medicare Advantage, drove a lot of providers out of the industry. And in rural America, they moved to the bigger urban metropolitan areas. And so we struggled to get the kind of physicians that we need in rural America to provide the health care that's needed. And so that's why telemedicine, telehealth is so vitally important.
And how has telehealth grown over the years? I mean, it's been around for a while. Where do you see it going?
Well, we have our challenges. Certainly the healthcare providers want to provide the health care. The information technology or the network providers want to provide the conduit through which to do that. The challenge is in the policy area. Licensing, certifications, reimbursement rates. Are you reimbursed based on where, if you're a healthcare provider, are you reimbursed based on where the patient resides, or are you reimbursed based on where you, the physician, resides? How does that all work? The VA, as believe it or not, we hear a lot of negativism about the VA and the inability to get care and treatment to our nation's heroes. But the VA is one of the leading agencies at the federal level in implementing telehealth. I've seen a lot of the examples as I travel around rural eastern and southeastern Ohio, small veterans clinics where they have the capability to talk with a nutrition counselor or a mental health counselor and those kinds of things via telehealth. And it's critically important.
President Trump and the VA Secretary announced some new initiatives on telehealth at the VA. Is that helpful for what specific problems? Is it mental health? What are the biggest problems that you're also hearing from your constituents on healthcare?
Well, I think mental health is certainly one that immediately jumps to mind because there's not necessarily a palliative exam, a palpable exam where the physician has to physically examine someone. It's all the mental health process. So that lends itself immediately to telemedicine. But clearly, with the right kind of approach, telemedicine can span the spectrum of healthcare needs. For example, I saw a demonstration not too long ago from the University of Cincinnati. They've developed a robot. I mean, it almost looks like something out of Star Wars. Stands about 3 foot tall, has a what looks like a head on it, but the head is a video monitor. And this robot can be in a home of a shut-in veteran, of a senior, whoever that might be, knows how to get itself back and forth to the charging station, and at pre-prescribed times can go up to the patient or whoever that is. It turns itself on. The patient is sitting there looking at the screen, and up pops the face of the doctor or the healthcare provider at the other end. And I can tell you, as a son of an 85-year-old mother that is struggling right now with cancer-related illnesses, and who does not want to go to a facility because she's so independent, that's very attractive to me, and it would be to many. And that keeps those people out of the hospital. We keep them out of the hospital. We keep them out of the emergency room. We're going to see healthcare costs go down. So that's another example of how telehealth can really change the landscape around healthcare in rural America.
Former Congressman Tom Price resigned as HHS Secretary. There are a lot of names that are being circulated: Bobby Jindal, Rick Santorum. Number one, do you have a favorite that you think the president should consider? And number two, what are the challenges that the new HHS Secretary is going to have to tackle?
Well, let me say, first of all, that Tom Price was my favorite. I was very disappointed to see Tom step down. The whys and wherefores of that is for a different discussion. But I was very disappointed because I thought Tom was exactly the right guy to do that job. He, being a practicing orthopedic surgeon and chairing the budget committee and having written several bills to reform our health care system, he was the right guy. I haven't seen a lot about who the alternatives are. Certainly, I have a lot of respect for Senator Santorum. Quite honestly, I don't know that much about his health care background. But to the salient part of your question, the important part, what challenges does HHS have? My goodness. I mean, we've got, and I said this was an indictment on Obamacare, but the truth of the matter is Obamacare continues to fail every day. And I can tell you in rural America, it's failing at a drastic rate, from the skyrocketing premiums to the abandonment of health care carriers on the exchanges, leaving tens of thousands, hundreds of thousands of people without a health care provider or a health care insurance company on the exchanges. It's made it extremely urgent that we fix this broken system. And we're going to have to work together to do that. And that's going to be a challenge of the new HHS Secretary. The individual marketplace has basically been destroyed. And we all know, we talk about innovation, and that's what the theme of today's discussion is. Anytime you get innovation and competition in the same room, what happens to quality? Quality goes up, cost goes down as people have choices. And that's what we're trying to get back to with the healthcare system.
We are going to open it up for questions in a few minutes, so think of some questions. I do want to ask you just on some of the pending healthcare issues right now. The CHIP deadline has passed, but Congress is working on that. Do you think that that will move quickly this month? And what do you think are going to be the ramifications of healthcare in the budget? There's a debate now of whether Republicans should put in Obamacare repeal in that legislation or just stick to tax reform.
Addressing the CHIP part is easy. There's a strong focus on getting that issue resolved. I can't tell you exactly when it's going to go, but I can tell you that I believe that there is the motivation to get that done. On the budget, who knows? Who knows? I can tell you that the Budget Committee, I sit on the Budget Committee, we have released and passed out of, unanimously, by the way, on the Republican side, out of the committee, a responsible budget that does begin some of those, sets the stage with reconciliation instructions for health care reform. But I don't know. I don't know. We'll see.
I do want to touch upon opioids. It's a big issue in your state. How has the healthcare system back home been able to deal with this epidemic?
It is a devastating condition, crisis across our country. I heard this morning that I believe Ohio is leading the nation in the number of opioid-related deaths, and I could sit here for the next 2 hours and tell you story after story after story of the heartbreak of families that have lost loved ones, lost children, lost husbands, lost brothers, you name it. I think our governor has acted appropriately in minimizing the amount of opioids that can be prescribed to a patient when they leave the hospital. I also believe where innovation is concerned, developing and putting a lot more effort into non-addictive pain medications, and we already know that there are some. I had a company, and maybe there's a representative of that company here today. I don't know who all is here, but I had a company come in and talk to me about some of those non-addictive non-addictive pain medications, but they have to be administered intravenously. So you have to go into it knowing up front when a patient is having surgery or you've got them in the hospital and you're going to release them home with pain management. You got to plan ahead for that because you can't take oral non-addictive pain medications, at least not yet, that I know of. I mean, maybe there's something that's come out in the last couple of weeks, but we need more advancement in that regard. How do we manage pain without prescribing opioids to folks?
I do want to open up for the audience. If you can, we have people with mics, so people watching online can hear it. If you can just identify yourself and ask the congressman your question. One up front.
Hi, Congress. Is it on? Okay. Hi, Congressman. My name is Veronica Leach. I'm a biomedical engineer, and I'm receiving my master's in public health right now. And I wanted to ask, because in my experience, when there's high competition, there's also a lack of sharing and collaboration in the scientific field on usually that particular subject. So how can we strike a better balance between competition and innovation? Because I think competition is important, but, Yeah.
Sure. Well, I certainly would not dispute your experience, but if we relate innovation and competition in other sectors of American society, whether it's in aviation or technology, it's exactly that combination of innovation and competition that does strike that balance. So I'd certainly be curious to talk with you more about what your experience has been on the healthcare side, but I think innovation and competition go hand in hand in terms of spurring quality and reduce cost. But I'd love to talk to you more. I have my healthcare legislative lead is here today. If you could step to the back and give her your card, I'd love to talk to you more, because I'd love to hear more about what you're talking about.
Any other questions from the audience? I do want to ask one question about, have you seen, you're talking about bureaucracy, have you seen a difference with the Trump administration compared to the Obama administration? What can this administration do to get rid of bureaucracy or clear regulatory hurdles? Have you seen a lot of progress on that?
I see progress in the sense that we have seen some regulatory burden released in the first 6 months of this administration. We saw some $65 billion worth of regulatory burden taken off of the backs of American businesses. Now, obviously, that was not all healthcare-related businesses. But I think you see a general attitude, and I've heard numerous members of the cabinet say it this way. Look, we're not trying to get rid of regulations that protect public health, public safety, national security, those kinds of things. But where we've got regulations just for the sake of regulation, it's a big issue. Let me give you an example, and you kind of teed this up for me. I hope I've got time to do this. If you look at America from 1868, we were never more divided as a nation than we were at the end of the Civil War. If you look at the 100-year period through 1970, look at all of the innovation that came about during that 100-year period. Space travel, communicating technologies, the airplane, the combustion engine, the light bulb, my God, all kinds of stuff. From 1970 through today, other than the internet, what are the really big innovations that have taken place? And I would submit to you that a lot of the reason why innovation has decreased is because big government has come in with a regulatory scheme that now tells the American people not only what we should innovate on, but when, where, how, and why. And I think we need to get these regulatory policies under control, protect public safety, protect public health, protect our national security, but unleash the ingenuity and innovative spirit of the American people, because that's what has grown the greatest nation on the planet.
Question right over here.
Good morning. I'm Rich Brennan with the Home Care Technology Association of America. I had a follow-up question on the VA and their use of telehealth. As you well stated, they have a pretty expansive program in serving the veterans. There's a proposed rule that's out that's recent that the VA has put out to relax basically the state lines. They would allow their providers to practice telehealth across the state lines. This is something that's been a barrier to the expansion of telehealth, obviously, in rural America. Do you think that that's a good step forward for also the innovation question? Maybe we'll see some innovation out of that as well, and maybe comment on sort of the use of regulatory levers to be able to create opportunities for more innovation in telehealth.
Absolutely, I do. I think that is a great step forward. As I mentioned earlier when I talked about telehealth in general, it's not the healthcare providers that don't want to provide it. It's not the network carriers that provide the networks over which telehealth runs. It is certainly not the software companies that build telehealth systems. It's the bureaucracy and the regulatory regimen that stifles the ability to really exploit this technology. And we need to do more of that kind of thing.
I'm afraid we've run out of time. Please thank the Congressman for being here this morning. Thank you, Congressman. Appreciate
Thank you very much.
Hand it over to Johanna. Appreciate it.